You are asleep. Everything is fine. And then, out of nowhere, a cramping, pulling, tight sensation jolts you awake at 2 in the morning. Maybe it's in your leg, maybe it's deep in your hip, maybe it's a dull ache in your lower back that won't let you get comfortable. You shift, you stretch, you wait for it to pass, and then you lie there for another 40 minutes staring at the ceiling, wondering what is wrong with your body. Nothing is wrong with your body. But something is wrong with one specific muscle, and almost nobody knows what it is. Today, we are fixing that for good. Waking up in the middle of the night because of physical discomfort is one of the most common complaints in modern life, and one of the least understood. Doctors tell you to stretch more, wellness influencers tell you to take magnesium, mattress companies tell you to buy a new mattress, and none of them are addressing the actual anatomical problem, the specific muscles that are chronically shortened, chronically overloaded, and chronically ignored by modern life, until they make their displeasure known at 2 in the morning. In this video, we are going to go deep on the 3 muscles most responsible for nighttime discomfort and disrupted sleep. We will understand exactly what each one is, why it tightens, what it does to your body when it does, and the precise 2-minute release protocol for each one that you can do in your bedroom before you sleep tonight. No equipment, no gym, just your body, the floor, and the knowledge that most people spend years trying to find. And before anyone in the comments says it, yes, if you have persistent pain that is significantly affecting your life, please see a physiotherapist or doctor. What I am giving you today is evidence-based movement therapy that works for the vast majority of people experiencing this kind of discomfort. It is not a replacement for medical advice. It is the information that should have been given to you years ago alongside that advice. Part 1. The psoas, the muscle nobody talks about. Let me introduce you to a muscle that is almost certainly causing you problems right now without you having any idea it exists. The psoas, pronounced psoas, is the deepest muscle in the human body. It originates from the sides of the lumbar vertebrae, the bones of your lower spine, runs diagonally through the inside of your pelvis, and attaches to a bony prominence called the lesser trochanter at the top of your femur, the main bone of your upper leg. It is the only muscle in the human body that directly connects the spine to the leg. That anatomical position makes it one of the most influential structures in your entire musculoskeletal system, and one of the most neglected. The psoas has 2 primary jobs. First, it flexes the hip, it pulls the thigh toward the torso. Every step you take, every time you sit down or stand up, the psoas is involved. Second, it stabilizes the lumbar spine during walking and movement. When you are upright and moving, the psoas is working constantly to keep your lower back from collapsing. Here's where the problem begins. The psoas is a hip flexor, which means it's in its shortened position whenever your hip is bent, and your hip is bent every single time you sit down. If you sit at a desk for 8 hours a day, commute for an hour, eat dinner seated, and then sit on a sofa for the evening, your psoas spends the majority of its waking hours in a shortened, contracted state. Over weeks and months and years of this pattern, it adapts to that shortened length. It loses its ability to fully lengthen. It becomes what physiotherapists call adaptively shortened, chronically tight even when you are standing or lying down. And when you lie down to sleep, which should be the most relaxed position your body assumes all day, a tight psoas creates tension. It pulls forward on your lumbar vertebrae, creating an anterior tilt of your pelvis and an exaggerated arch in your lower back. This compresses the facet joints of the spine, irritates the surrounding nerves and soft tissue, and creates that restless, uncomfortable, aching sensation that prevents deep sleep or wakes you from it entirely. The problem is not your mattress. The problem is a muscle that has been sitting in the same position for most of your waking life and has forgotten how to let go. There's a second consequence of a tight psoas that most people never connect to the muscle, and that is its relationship with the nervous system. The psoas sits directly adjacent to the sympathetic nerve chain, the system responsible for your body's stress response. When the psoas is chronically tight, it creates a low-level, continuous stimulation of the sympathetic nervous system that keeps your body in a subtle state of alertness. Not enough to notice during the day, but enough to prevent the deep parasympathetic rest and recovery state your body needs to fall into deep sleep. Releasing the psoas is not just a muscular fix, it's a neurological one.
The piriformis release, the 2-minute protocol. Do this on your bedroom floor before sleep every night. No equipment required. The entire sequence takes 2 minutes. Step 1. The constructive rest position, 60 seconds. Lie flat on your back on the floor, not your mattress, which is too soft for this to work. Bend both knees and place your feet flat on the floor, hip-width apart. Let your arms rest at your sides, palms facing up. Now do nothing. That is the instruction. Allow gravity to work on your pelvis. As the muscles of your lower back and hip flexors gradually release, you will feel your lumbar spine slowly descending toward the floor. This position, developed by movement educator Lulu Swigard, is the position in which the psoas is most able to release its holding patterns without any muscular effort from you. Stay here for 60 full seconds. Breathe deeply and slowly. 2. The psoas lunge stretch, 30 seconds each side. From the floor, come into a kneeling lunge position. One knee on the ground directly under your hip, the other foot forward with the knee bent at 90 degrees. Your back should be tall and upright. Now slowly shift your weight forward onto the front foot until you feel a deep stretching sensation at the front of the hip on the kneeling side. That sensation is the psoas lengthening. Hold it. Do not arch your lower back to get a deeper sensation. Tuck your pelvis slightly under and maintain a neutral spine. The stretch should be felt deep in the hip, not in the lower back. Hold for 30 seconds, breathing slowly and deliberately into the sensation. Switch sides, 30 seconds on the other leg. 2 minutes. That is the complete psoas protocol. Most people notice a difference in how their lower back feels within the first 3 nights of consistent practice. For some, the relief is immediate. Part 2. The piriformis, the muscle behind your sciatic pain. If the psoas is the most commonly overlooked muscle in the front of the hip, the piriformis is its counterpart in the back. And while the psoas tends to produce deep aching and lower back discomfort at night, the piriformis has a very particular signature when it tightens, a sharp, shooting, burning pain that travels from the buttock down the back of the leg, sometimes as far as the foot. You may know this as sciatica, but in many cases it is not a spinal problem at all. It is a piriformis problem. The piriformis is a small pear-shaped muscle that sits deep in the gluteal region, underneath the gluteus maximus, the large visible buttock muscle. It originates from the front surface of the sacrum, the triangular bone at the base of your spine, and attaches to the greater trochanter of the femur, at the outer top of the thigh bone. Its primary function is external rotation of the hip, turning the foot outward when the leg is straight. Here is what makes the piriformis so problematic. In approximately 17% of people, the sciatic nerve, the largest nerve in the human body, passes directly through the piriformis muscle rather than beneath it. In the remaining 83%, it passes just beneath it. Either way, when the piriformis is tight and inflamed, it compresses or irritates the sciatic nerve. The result is what is clinically called piriformis syndrome, and it produces the exact symptoms commonly attributed to a herniated disc: pain in the buttock, radiating pain down the leg, numbness, tingling, and a deep aching that is worst when sitting or lying on that side. Why does the piriformis tighten? The same reason the psoas does: sitting.
When you sit, particularly with legs crossed or in positions that externally rotate the hip, the piriformis is held in a shortened, contracted position. Add to that the gluteus maximus, which should be sharing the workload of hip stability, is switched off by prolonged sitting, and the piriformis ends up compensating for an absent glute. It becomes overworked, hypertonic, and eventually a source of significant pain that is worst at night when the body is still and the nerve irritation has nowhere to hide.
The piriformis release, the 2-minute protocol. This sequence targets the deep external rotators of the hip and creates direct space around the sciatic nerve pathway. Do it before sleep on the same floor as the psoas protocol. Step 1. Supine piriformis stretch, figure 4. 60 seconds each side. Lie on your back with both knees bent, feet flat on the floor. Cross your right ankle over your left knee, creating a figure 4 shape with your legs. Flex your right foot, pulling the toes towards your shin to protect the knee joint. Now either stay here if you already feel a deep stretch in the right buttock, or draw the left knee toward your chest by interlacing your hands behind the left thigh. As the left thigh comes closer to your chest, the stretch in the right piriformis intensifies. You are looking for a deep, significant sensation directly in the center of the buttock, not a sharp pain, but a deeply satisfying release. Hold for 60 full seconds. Breathe slowly. With every exhale, allow yourself to sink a little deeper into the position. Switch sides and repeat. Step 2. Seated piriformis release, 30 seconds each side. Sit upright on the floor with both legs extended in front of you. Cross your right leg over, placing your right foot flat on the floor beside your left knee. Place your right hand on the floor behind you for support. Now bring your left elbow to the outside of your right knee and gently use it to rotate your torso to the right. You should feel a deep rotational stretch through the right hip and buttock. Hold for 30 seconds per side. This seated variation adds a rotational component that targets the deeper fibers of the piriformis that the lying version cannot fully reach. For those experiencing sciatic symptoms, the shooting pain down the leg, consistent daily practice of this protocol for 2 to 4 weeks is one of the most evidence-supported non-surgical interventions for piriformis syndrome. Be patient. Nerve irritation resolves more slowly than muscle tightness. Part 3. The calf and soleus, the culprit behind nighttime cramping. If you have ever been pulled violently from sleep by a calf cramp, that sudden seizing involuntary contraction in the back of the lower leg that makes you gasp and scramble out of bed, then this section is for you. Nocturnal leg cramps affect an estimated 60% of adults at some point and become increasingly common with age, physical activity levels, and hydration habits. And yet they remain one of the most poorly understood and poorly addressed issues in mainstream fitness. The muscles responsible are the gastrocnemius and the soleus, the two muscles that make up what we commonly call the calf. The gastrocnemius is the larger, more superficial muscle that creates the visible shape of the calf. It crosses both the knee and the ankle and is involved in both knee flexion and plantar flexion, which is the act of pointing the foot downward. The soleus is a deeper, flatter muscle that only crosses the ankle and is primarily active during sustained standing and walking. Together, they are among the most heavily loaded muscles in the body, bearing the full weight of your body weight with every step. Nocturnal calf cramps happen for a combination of reasons that are well documented. The first is muscle fatigue. When the calf muscles have been under sustained load during the day, from exercise, from prolonged standing, or from long periods of walking, the motor neurons controlling those muscles become hyperexcitable as fatigue accumulates. At night, when normal motor activity should cease, these overexcited neurons can fire spontaneously, triggering the involuntary contraction of the entire muscle, the cramp. The second contributor is hydration and electrolyte balance. Sodium, potassium, magnesium, and calcium all play roles in the nerve-to-muscle signaling that controls contraction and relaxation. When these electrolytes are out of balance due to inadequate hydration, excessive sweating during exercise, or a diet low in key minerals, the precision of that signaling is compromised, and the muscle is more prone to uncontrolled contraction. The third, and most relevant to what we can fix through movement, is the shortened position of the calf at night.
When you sleep on your back or your front, your feet naturally fall into plantar flexion, pointing slightly downward. This keeps the calf in a shortened position for hours. In an already fatigued and potentially electrolyte-compromised muscle, this sustained shortening is the trigger that tips the nervous system into involuntary contraction. The cramp doesn't come out of nowhere, it is the result of a muscle that has been building towards that moment all day. Releasing it before sleep dramatically reduces the likelihood of it happening.
The calf and soleus release, the 2-minute protocol. These two releases address both calf muscles with targeted intensity and take less than 2 minutes combined. The distinction between the two stretches matters. The gastrocnemius and soleus require different knee positions to be fully targeted. Step 1. Standing gastrocnemius stretch, 30 seconds each side. Stand facing a wall, place both hands on the wall at shoulder height. Step your right foot back approximately 2 to 3 feet, keeping the heel firmly on the floor and the leg straight. Your left leg is slightly bent in front. Lean your body toward the wall until you feel a significant stretch in the back of the right calf, specifically in the upper medial portion. Do not let the heel lift. The heel staying down is what creates the stretch. Hold for 30 seconds per side, breathing steadily. This stretch targets the gastrocnemius, the larger, more superficial muscle that is most commonly involved in the acute cramping sensation. Step 2. Soleus stretch with bent knee, 30 seconds each side. Remain in the same wall position, but now bend the back knee. Keep the heel on the floor and sink the hips slightly downward. The stretch now shifts lower and deeper in the calf, into the soleus, which only stretches when the knee is bent. This is the muscle most people miss entirely when stretching their calves, and it is often the deeper source of nighttime cramp tension. Hold for 30 seconds per side. Step 3. Foot flexion before sleep, 30 seconds. Lie on your back in bed. Before you close your eyes, flex both feet firmly. Pull your toes toward your shins as if trying to touch your toes to your knees. Hold for 5 seconds, then release. Repeat 6 times. This simple action breaks the shortened position of the calf that makes nighttime cramping so likely and resets the muscle length before the hours of stillness that follow. It takes 30 seconds, and it is one of the most effective single interventions for preventing nocturnal calf cramps in clinical practice. Now, let me put all 3 protocols together into one complete bedtime routine that takes between 6 and 8 minutes and addresses every muscle we have discussed. This is the routine. You do it on the floor of your bedroom every night before you sleep. You start with the constructive rest position, flat on your back, knees bent, feet flat on the floor, arms at your sides. You stay here for 60 seconds and simply breathe. Let the floor support you. Let the psoas begin to release. This first 60 seconds is not nothing. It is one of the most powerful passive decompression techniques in physical therapy. From there, you move into the psoas lunge stretch. One knee on the floor, one foot forward, torso tall, shift forward until you feel the deep front of hip sensation. 30 seconds on the right side, 30 seconds on the left. Stay tall, tuck the pelvis gently, and breathe into the stretch rather than against it. Next, roll onto your back and move into the figure 4 piriformis stretch. Right ankle over left knee, draw the left thigh toward your chest. 60 seconds on the right hip, 60 seconds on the left. No rushing. The piriformis needs time to respond. 30 seconds is not enough for a muscle this deep. Then come to seated for the rotational piriformis release. Right foot crossed over the left knee, left elbow to the outside of the right knee, gentle rotation toward the right. 30 seconds each side.
Now stand for the calf releases. Gastrocnemius stretch first, legs straight, heel down, lean into the wall, 30 seconds each side. Then the soleus stretch, same position but knee bent this time, 30 seconds each side. Finally, get into bed and perform 6 repetitions of foot flexion, pulling both toes toward your shins and holding 5 seconds each time. Close your eyes. You have just systematically released every muscle most likely to wake you up tonight. Total time, 6 to 8 minutes, every night. That is the entire protocol.
Part 4. The lifestyle factors that make this worse. The bedtime routine addresses the immediate problem, but if you want to stop this from being a recurring issue, if you want to get to a point where you sleep through the night consistently without discomfort waking you, you need to also address the lifestyle inputs that are creating the tightness in the first place. Prolonged sitting is the single largest contributor to everything we have discussed today. The psoas tightens because you sit. The piriformis overworks because your glutes switch off when you sit. The calves stiffen because you are not moving them. If you sit for the majority of your working day, you need to interrupt that sitting with movement regularly. The research is consistent. Standing and walking for 2 minutes every 30 minutes of prolonged sitting significantly reduces the degree of hip flexor and calf tightening compared to uninterrupted sitting. Set a timer, get up, walk. It does not need to be more complicated than that. Hydration directly affects your risk of nocturnal calf cramps. Most people are chronically mildly dehydrated, not severely, but enough to tip the nervous system's sensitivity towards spontaneous muscle firing at night. Aim for your body weight in pounds divided by 2 in ounces of water per day. And on days when you train hard and sweat significantly, add electrolytes, sodium, potassium, and magnesium, not just more plain water. Magnesium specifically deserves mention. Magnesium plays a critical role in muscle relaxation. It is the mineral that allows contracted muscle fibers to release. Research on magnesium supplementation for nocturnal leg cramps shows consistent benefit, particularly in older adults and physically active people. 200 to 400 milligrams of magnesium glycinate taken in the evening is one of the most evidence-supported interventions for sleep-disrupting muscle cramps available without a prescription. Finally, and this is the Fit Pulse, so of course this comes up, building the muscles that support these structures makes everything better long-term. Strong glutes reduce the compensatory burden on the piriformis. A strong mobile posterior chain reduces the compression on the psoas. Strong, well-conditioned calves recover more completely from daily loading and are less prone to the fatigue-driven excitability that causes nighttime cramps. The bedtime routine fixes the problem tonight. Training your body correctly fixes it permanently. Your body has been trying to tell you something every time it wakes you up at night. Not that something is broken, not that something is wrong beyond fixing, but that something has been neglected. A small group of deep, powerful muscles that modern life tightens every single day and almost nothing in modern life addresses. The psoas, tightened by every hour you spend seated, pulling your lower back forward and compressing your spine while you sleep. The piriformis, overworked by absent glutes, irritating the sciatic nerve and creating the deep buttock and leg pain that ruins nights and makes mornings miserable. The calves, fatigued, shortened, and primed for nocturnal cramping by hours of loading followed by hours of stillness. 2 minutes. That is all the time these muscles need from you to begin releasing the tension they have been holding. 6 to 8 minutes for the complete protocol, every night. Start tonight and notice what tomorrow morning feels like differently. If this video helped you, share it with someone who needs it. The person who wakes up at 3 in the morning wondering what is wrong with their body needs to see this. Subscribe to the Fit Pulse for more science-backed content that addresses the problems most fitness channels never think to cover. See you in the next one.